Hello and welcome to One World, One Heart show, presented by Medgate Today TV Digital, powered by Advanced Media Group and sponsored by Involution. This is the show where we bring you insights from the world's top cardiologists on how to keep our heart healthy and live a longer life and stronger life. Today, we are honored to have with us Dr. Ankesh Kumar Agarwal, Senior Consultant Interventional Cardiology at Fortis Hospital Shalimar Bagh, Delhi, who will be sharing his expertise and valuable insights how to keep our heart healthy and help us understand how to take better care of our heart. So let's dive into the conversation and discover how knowledge and awareness can truly save our lives. Hello, sir. Thank you so much, sir, for coming here and give us at the time at Medgate Today studio, where we will discover how to keep our heart healthy, what are the myths, what are the awareness things, so that our masses, our audience will get to know and they will live a longer life and a stronger life.
Yeah, hi. Myself, Dr. Ankesh Kumar Agarwal. I am a senior consultant cardiologist at Fortis Hospital Shalimar Bagh and also available at Goel Neuro Heart Care, Shasti Nagar in the evening time. So we'll talk about the heart health today. Today's scenario, where is the younger population with our lifestyle and living habits and dietary habits, which leads to bad dietary habits of more of junk food eating, unhealthy processed food eating, and inactivity, lack of exercises, lot of stress, lack of sleep, which leads to inflammatory changes and plaque modification in the arteries, plaque formation and coronary artery disease, which lead to more of heart attack event and heart failure event in younger population, which is critical for heart health. So what we can do for that, we should follow regular healthy heart and healthy lifestyle. Like our diet should be healthy, avoid of junk food, processed food, more of legumes, green vegetables, nuts, more of avoiding processed food. Where the activity comes to, we should exercise regularly, at least 150-minute moderate aerobic exercise in a week, or 2 hours exercise of heavy activity like weightlifting and muscle strengthening exercise that keep your heart muscle strengthened and healthy. Our diet also I told you, and at least we should have 7 to 9 hours of proper sleep, and our stress management, exercise, by keeping exercise, meditation, yoga, that reduce our stress. All these points will help your heart to keep healthy and give you longer life.
Thank you so much, sir, for telling this. जैसा कि आपने बताया कि आपने एक ही पैराग्राफ में सब कुछ सम अप कर दिया, तो what I get from your side that lifestyle is very important and the things whatever we are doing every day is just keeping the record on our body. So related to this only, sir, how much of heart disease are caused by lifestyle and genetics?
Yeah, genetic part is very important in every kind of disease. If we are talking about heart, so we are having very different kind of heart disease. So different kind of heart disease have different genetic relation and genetic incidences.
Yes.
So we can talk about 40 to 50% of heart disease is caused by genetics, where the 50 to 60% caused by the lifestyle interventions.
Okay.
Like lack of inactivity, more of dietary habits, lack of sleep, another thing. In genetics, we can talk about like cardiomyopathies, like hypertrophic cardiomyopathy. Most of these cardiomyopathy type caused by 90% of cases genetic relations. Whereas arrhythmias, some of familial arrhythmias caused by mostly by genetic inheritance. But some are exercise related arrhythmias and heart disease. In terms of coronary artery disease, artery में blockage की हम बात करें, some of documented as very few evidence with the genetic inheritance. Where the familial history is also important, where person carry these diseases from family. If suppose हम बात करें कि फैमिली में किसी को हार्ट की और डायबिटीज की बीमारी है पहले फैमिली मेंबर में, उन लोगों को हार्ट की डिजीज होने के चांसेस काफी ज्यादा होते हैं.
ओके, और उसको कैसे कंट्रोल कर सकते हैं? जस्ट बाय कीपिंग आवर लाइफस्टाइल हेल्दी.
या, लाइफस्टाइल इज वेरी इंपॉर्टेंट पार्ट ऑफ आवर लाइफ. If your family member is having past history of your father, mother, or your grandfather, mother having heart disease or diabetes, you should be very cautious. आपको बहुत cautious रहना है, ध्यान रखना अपने lifestyle पे. You should control regular exercise to control your weight. Your diet should be healthy. You should avoid any unprocessed meal and unhealthy diet. You should avoid smoking, you should avoid alcohol, and you should also, nowadays youngsters, what is the most important factor contributing to cardiac disease is stress, because youngsters having a lot of stress, work related stress or family stress. So you should focus on your stress management, regular daily
My next question
meditation.
is on this only, sir.
Yeah.
Like these days, stress is on the top of everyone's lifestyle, everyone's life. So how people can just manage their stress to control the heart disease risk and to control the upcoming, you can say dangerous diseases, which is going to be happen in their body due to stress.
Yeah, for stress management, you should balance your life. You should take proper sleep. First of all, come to the sleep. If you are taking regular 7 to 9 hours of sound sleep, that will give a lot of because sleep.
So what is sound sleep?
Sound sleep, yeah, it's a regular sleep. It should not be disturbed sleep, like you are going to bed and in midnight you are your sleep is disturbed, you are getting up and all this. You should be sound at least 6 hours sleep, no disturbance in the sleep, because sleep is the very important part of heart health that gives rest to your heart. हम देखते हैं कि स्लीपिंग टाइम में हार्ट रेट कम हो जाती है, ब्लड प्रेशर कम हो जाता है. दैट्स द पार्ट ऑफ स्लीप दैट गिव्स रेस्ट टू योर हार्ट, दैट ऑल्सो relieve your stress on the heart. So better functioning of heart, better blood flow, that allow the heart to keep in the daytime.
And how to manage the stress? Just keeping the lifestyle healthy, meditation or anything
meditation
else?
You should be doing regular morning exercises, either in the form of brisk walking, jogging, cycling, swimming, kind of aerobic exercises. Or you can also do at least twice a day in a week weightlifting or muscle strengthening exercises, yoga and meditation give relaxation to your mind, so that is very important for stress management.
Okay. Sir, nowadays we are seeing that from age group of, you can say from 18 only, people are having stress. And when it goes to 50 or when the chances of having any kind of disease inside the body is higher. And many people say that we are younger, we will not catch any kind of disease. So is it a myth that being a younger person, it doesn't mean that you will not get a disease?
Yeah. So it's a myth, it's a false impression that I am young, I don't have any diseases, so I can't get any diseases. It's a myth. Initially, few decades ago, we were used to talk कि western population having disease, cardiac disease की 60 साल के बाद में उनमें cardiac disease होगी, और Indian population are very prone to these diseases की इंडिया में ये था कि 50 के बाद में आपको cardiac disease होगी. But nowadays not like that. Cardiac disease can occur from childhood to any age. Okay. So it's very important to focus on your heart from early age.
Yes.
Yeah. So after COVID, we are getting lot of youngsters with the heart attack, major heart attacks, and with bad disease because of stress level is goes up post COVID. They are either work stress or any kind of stress that lead to plaque formation in their arteries and artery blockage. Also, they have an acute clot in their arteries that lead to heart attack. Also, arrhythmias, so they are very high risk for sudden cardiac death. Youngsters.
Arrhythmia क्या होता है सर?
Arrhythmia हार्ट की इलेक्ट्रिकल एक्टिविटी होती है जिसमें कि हार्ट की हार्ट रेट काफ़ी ज़्यादा बढ़ जाती है, उसमें हार्ट एकदम स्टैंड स्टिल हो जाता है और हार्ट का ब्लड पंपिंग फंक्शन रुक जाता है, जिससे ब्लड पंप होना बंद जाता है और कार्डियक अरेस्ट हो जाता है.
तो ये कौन से एज ग्रुप में ज़्यादा होते हैं या ये एक नॉर्मल है?
ये नॉर्मल है, किसी भी एज में हो सकता है कार्डियक अरेस्ट, किसी को भी डिपेंड करता है कि उनका बेसलाइन रिस्क फैक्टर क्या है और क्या लाइफस्टाइल है, उनको क्या इवेंट हुआ है. अगर सडन इवेंट हुआ है तो उसमें अरिथमिया होने के चांसेस ज़्यादा होते हैं. कुछ लोगों को आर्टरीज में ब्लॉकेज के अलावा खाली अरिथमिक इवेंट होता है, जैसे मैंने बताया जेनेटिक फैमिली अरिथमिया होते हैं, वेंट्रिकुलर टैकीकार्डिया हो गया, वेंट्रिकुलर फिब्रिलेशन हो गया. दोज पीपल आर एट हाई रिस्क ऑफ सडन कार्डियक अरेस्ट पल्स रेट बढ़ने की वजह से.
हम इन सब चीज़ों को कैसे कंट्रोल कर सकते हैं, कैसे हम प्रिवेंट कर सकते हैं और क्या क्या टेक्नोलॉजीज आ गए हैं जिसके हेल्प से हम लोग अपने डिजीज को पहले ही कंट्रोल कर सकते हैं?
देखो, डिजीज कंट्रोल करने के लिए सबसे पहले चीज आता है कि प्रिवेंशन बेटर देन द ट्रीटमेंट, व्हाट वी से. सो प्रिवेंशन, वी ऑलवेज नोज कि हमारी फैमिली में कोई डिजीज है तो वी शुड बी वेरी कॉशियस. वी शुड गो फॉर रेगुलर हार्ट हेल्थ चेकअप. After the age of 20 to 30, we should every 3 to 5 years we should go for our health checkup for cardiac related problems. After 30 or 40, every 2 to 3 years. After 40, at least annually, we should check for our heart health. if you are having any symptoms or any comorbidity like diabetes, hypertension, frequently we should go either in 6 months or more early, so for depending on your risk. So we can come to know early and we can start treatment early. In that case we can prevent, or early treatment is better.
Sir, आपने during your conversation you mostly talk about lifestyle and diets, and nowadays nutritionist, gym trainer and many other people who are there, they talk about कि you just cut down the sugar. So how sugar is related to our heart disease and diabetes, which is basically the main cause of the heart disease nowadays, how diabetes closely just killing our heart, and how diabetes and heart interconnected?
Yeah, well said. Sugar and diabetes are very strongly related to the heart health, because in India now we are entering the epidemic of diabetes.
Yes.
Every fourth person we can say ki diabetic.
Bilkul.
Either youngsters, especially obesity, because of poor diet habit, we are landing in the obesity pandemic. Obese patient having either diabetes or, more so important, they are pre-diabetic range.
Okay.
Undetected pre-diabetic, because they having thought we are healthy, we should not check.
Yes.
If they check, they come to know in pre-diabetic. That's the phase where they should take a step to prevent, control their weight. Sugar, what sugar did, high blood sugar level lead to the inflammatory cascade, inflammation. They damage the inner layer of the arteries, where plaque formation, lipid deposition start, and then lipid form the plaque. Plaque what will lead to blockage of the artery. That lead to the heart event. Also, sugar and diabetic patient having heart muscle sugar level goes up, that lead to scarring, fibrosis. वो थिकन होने लगते हैं. वहाँ पे थिकनिंग की वजह से हार्ट की मसल की फंक्शनिंग में कमी आ जाती है, जिसकी वजह से वो हार्ट फेलियर के लिए प्रोन हो जाते हैं. उन पेशेंट में हार्ट फेलियर वाले और हार्ट अटैक वाले इवेंट ज़्यादा होते हैं. और डायबिटीज़ ऑल्सो इन्वॉल्व नस, न्यूरोपैथी, नस जो नर्व्स को इन्वॉल्व करते हैं, उसकी वजह से उनको पेन सेंसेशन नहीं होते हैं. जो हम कहते हैं ना कि चेस्ट पेन हुआ उसे हार्ट अटैक हो गया, डायबिटिक पेशेंट में समटाइम चेस्ट पेन नहीं होता है, तो साइलेंट अटैक्स आर मोर कॉमन. समटाइम हमने सुना है कि घर पे हार्ट अटैक हुआ और पेशेंट एक्सपायर हो गया.
That's why diabetes is also known as silent killer.
Yeah.
Okay.
Diabetes and hypertension both are silent killer, because hypertension में आपको कोई सिम्टम्स नहीं होते हैं. Until unless the stage you come to symptoms की उसे स्ट्रोक हो गया, हार्ट अटैक हो गया, सीवियर हेडेक हुआ, उसके बाद में ब्रेन में ब्लीड हो गया.
Yes.
उससे पहले हाइपरटेंशन कई सालों तक चलता रहता, पेशेंट को सिम्टम्स नहीं होता, अनडिटेक्टेड रहता है वो. दैट्स वाई हाइपरटेंशन एंड डायबिटीज आर साइलेंट किलर फॉर हार्ट.
ओके. एंड अगर किसी इंसान को डायबिटीज भी है, हाइपरटेंशन भी है और कोलेस्ट्रॉल भी है, व्हाट आर द चांसेस, व्हाट इज द मिनिमम एंड मैक्सिमम चांसेस ऑफ हैविंग सच काइंड ऑफ द डिजीज?
इट डिपेंड ऑल्सो, मोस्ट इंपॉर्टेंट रिस्क फैक्टर इज एज ऑल्सो. If same person with the diabetes, hypertension, dyslipidemia in the early 40s, and one person in the 60s or 70s, so 60s and 70s patient is a very high risk of having cardiac events. We can say 20-30%. Okay. Or if patient is in 40s, those are having high risk of cardiac event, although less. We can say 5 or 10%.
Okay. So age group matters while
Yes.
having such kind of disease inside their body. एंड अब मैं बात करना चाहूँगी सर विमेन के बारे में. हाउ मच विमेन आर लाइकली टू हैव this kind of disease inside her body, and being a workaholic person, managing professional plus the family, the personal life. So how to have a healthy life for women, how they can keep their heart healthy?
Yeah, initially we say कि female में heart disease कम होते हैं man से. It's a myth. Both genders have same kind of events, although women have not typical symptoms of heart related issues, so they are having atypical symptoms. That's why they are underdiagnosed or misdiagnosed, having कि gastritis हो रहा है, anxiety symptoms हैं, so they are later diagnosed. So their diseases are bad because of underdiagnosis, but they are having same kind of disease. As you said, workaholic, she is managing home also, work also, so their stress level is high. That's why they are more prone for having heart events. And they are heart events are more prone, but they generally don't have typical heart symptoms like chest pain. They generally present कि breathing में difficulty हो रही है, घबराहट हो रही है, uneasiness feel हो रहा है, इग्नोर कर देते हैं. जनरली हम सोचते हैं कि फीमेल है तो एंजाइटी ज़्यादा होगी, इंडाइजेशन होगा, गैस्ट्राइटिस हो रहा, गैस बन रही है, सो हम वो उन्हीं पे फोकस. और फीमेल बीइंग ए फीमेल वो भी इग्नोरेंट रहती हैं कि चलो गैस होगी, कुछ नहीं है, काम कर रही हूँ, इसकी वजह से हो गया है, सो वो इग्नोर करते हैं हेल्थ को. फीमेल में
So
स्पेशली.
while having pregnancy, the you can say the heart has double burden on itself, because heart is pumping the blood for the lady and for the baby
Fetus.
as well, for the fetus. Yes, for the fetus. So how much it is important to keep our heart healthy while having the pregnancy?
During pregnancy, definitely heart has to pump blood for fetus and mother also.
Yes.
Workload increases. So if we talk about the healthy female, healthy heart cope up with both. Heart have muscle power has to pump blood for. If some lady, sometime we come to know heart disease during pregnancy.
Yes.
Because of workload. Women remain asymptomatic during their normal life. During pregnancy, they come to know they are having heart disease, especially valvular disease. Because इंडिया में रोमेटिक हार्ट डिजीज, वॉल में ब्लॉकेज हो गया, वॉल लीक कर गया, ये बचपन से होता है बिकॉज ऑफ सम इन्फेक्शंस. सो एट द एज ऑफ 3 years to 8 years वी हैव रोमेटिक हार्ट डिजीज इन इंडिया वेरी कॉमन. स्पेशली वी कम टू नो ड्यूरिंग प्रेगनेंसी इन फीमेल्स कि वो, क्योंकि उस टाइम पे वर्कलोड हार्ट कोप अप नहीं कर पाता है. जो वो लीक करते हैं वो पेशेंट तो फिर भी कोप अप कर लेते हैं. जिनका ब्लॉकेज होता है, ब्लॉकेज के जब ब्लड पंप नहीं कर पाता है, वो हार्ट फेलियर में लैंड अप कर जाते हैं.
Okay.
वो होता है. अदरवाइज इन हेल्दी फीमेल हार्ट इज वेल इक्विप्ड, वेल बैलेंस्ड ऑर्गन टू कीप अप दैट लोड.
Okay. And sir, fetus को कितने chances होते हैं कोई heart disease होने के?
ये सब इनहेरिटेंस पे डिपेंड करता है. जेनेटिक फीटस जनरली हैव जेनेटिक डिजीजेस, लाइक कोई वल्वुलर सेप्टल डिफेक्ट हो गया, कोई वॉल एबनॉर्मलिटी हो गई, वेंट्रिकल की दीवार में कोई छेद हो गया, या उसमें एक सिंगल वेंट्रिकल हो गया 2 चैम्बर की जगह पे चैम्बर डिफेक्ट हो गया. ये सब जेनेटिक पे डिपेंड करता है. और नाउ डेज इट्स वेरी कॉमन. अर्ली इरा में ये होता कि मैरिज टाइम पे होते थे. ठीक है. नाउ लेट मैरिज ऑल्सो लीडिंग टू दिस. आफ्टर 35 ऑफ मैरिज increases the chances of fetal heart diseases.
Okay, so nowadays पूरा जैसे पहले समय था, अब तो डेफिनेटली वैसा नहीं है. पहले के समय में लोग जल्दी शादी कर देते थे, जल्दी फैमिली प्लानिंग करते थे. बट नाउ एवरीवन इज जस्ट गेटिंग मैरिड आफ्टर 35 ओनली, एंड दे आर प्लानिंग देयर family after, you can say, 38, 39. So does this really making a bad impact on the society and on the health?
Yes, definitely, because we are already living our good amount of life, 20 to 30. In the working woman, stress level goes up. They also having some most of women having pre-diabetic, diabetes, hypothyroid detected during pregnancy.
Yes.
Because of late marriage. Stress is leading to this. And after 35, there are certain chances of risk of having heart disease in fetus. They are documented in healthy women also. So those goes up if we are having all those. Diabetes, smoking also contribute to fetal heart diseases.
And so, see, many people say that it is okay that men is having smoke or they are having alcohol, but it is not good for the women. So in my perspective, it is bad for both. It is not good for one person or the another person. And how these two, tobacco and alcohol, is just killing the body.
Yeah, alcohol and tobacco both are bad for health. Either woman, we talk about the woman, or we talk about the man. For both they are. Nowadays in the pollution, environment factor, we are having a lot of pollution. The passive smoking, these are equally harmful for the heart health, like active smoking. So smoking is 100% injurious to the health. Either we can smoke 1 or 2. Someone say कि I am smoking only 1 या 2 सिगरेट पीता हूँ,
बिल्कुल
चेन स्मोकर नहीं हूँ. Either we talk about the chain smoker or who is smoking 1 or 2. They are equally harmful for heart health.
Yes.
Not just like I am taking. Smoking contain nicotine. Nicotine क्या करता है कि आपके इन्फ्लामेशन को इंक्रीज कर देता है बॉडी में, और एड्रेनलिन हार्मोन ये सब इंक्रीज करता है. वो हार्ट रेट और ब्लड प्रेशर को इंक्रीज करते हैं. उसकी वजह से आर्टरीज में डैमेज होता है. सेम प्लाक फॉर्मेशन होता है, आर्टरी में ब्लॉकेजेस बनने लगते हैं. साथ में ब्लॉकेज की वजह से आर्टरी की स्कारिंग की वजह से डायलेट हो जाती है, जो एक्टिविटी की वजह से फैल जाती है, और वहाँ पे फैलने की वजह से क्लॉट बनने लगते हैं.
सर, आफ्टर कोविड वर्क फ्रॉम होम इज़ वेरी कॉमन. बच्चे ज़्यादा स्क्रीन टाइमिंग को वैल्यू देने लग गए मोर देन द एक्सरसाइज. जो हमारे टाइम पे होता था, हम लोग घर में टिकते नहीं थे. बट ड्यू टू दिस, यू कैन से लाइफस्टाइल चेंज, बच्चों में हार्ट डिजीज होने के चांसेस क्यों बढ़ गए हैं? जस्ट बिकॉज वो लोग अपना फिजिकल एक्टिविटी कम कर दिए. कितना फिजिकल एक्टिविटी मायने रखता है हमारे हेल्दी हार्ट के लिए?
फिजिकल एक्टिविटी इज वेरी इंपॉर्टेंट फॉर हार्ट हेल्थ. If combined with diet, is very important part of life that lead to heart diseases numerously increased. So during COVID time, work from home increased the stress, because working hours are increased during work from hours.
Yes.
So that lead to increase screen time and increase stress level. Because पहले होता है ऑफिस में गए 8 घंटे काम किया, घर आ गए, स्ट्रेस लेफ्ट इन द ऑफिस. नाउअडेज व्हाट हैपेंड, यू आर एट होम डूइंग स्क्रीन टाइम, बॉस ने कभी भी कॉल कर दिया, रात को 10 बजे भी मीटिंग चल रही है, सो इसकी फैमिली टाइम कम हो गया. बच्चों का क्या हुआ, बच्चों ने स्क्रीन देखना स्टार्ट कर दिया, देयर ईटिंग हैबिट गोज बैड, देयर ओबेसिटी गेटिंग इंक्रीज, फिजिकल इनएक्टिविटी गेटिंग इंक्रीज. सो एक्टिविटी पार्ट चला गया, डाइट चली गई, सो हार्ट डिजीज के इंसिडेंस बढ़ गए, प्री डायबिटिक डायबिटीज के इंसिडेंस बढ़ गए हैं. So
I think the whole main cause, the root cause of every disease is just lifestyle. If you can just manage your lifestyle, if you can just lead to a healthy life, that will give you a stronger and longer life for your healthy body. So my last question to you would be, so what one message you would like to give to the masses on this World Heart Show, how to keep their heart healthy? And it's not we say that it's a high time, but it's not at all very late unless and until you execute a good, you can say lifestyle, a good thing in your body.
Yeah, if you are starting lifestyle, it's never be late. Okay, for one line, you should be balanced healthy lifestyle, which is the key to keep your heart healthy. In the balanced healthy lifestyle, your diet should be healthy, proper, avoidance of junk food, processed food, and high calorie bakery diet should be avoided, where your diet should contain legumes, nuts, seeds, whole grains. Fish you can take that contain the polyunsaturated acid, omega-3 and omega-6 polyunsaturated fatty acids that are healthy for health. You should have regular physical activity of at least 150 minutes of moderate aerobic exercise and at least 2 days of muscle strengthening or heavy exercise that help your weight. You should have a proper sleep of at least 6 to 8 hours, sound sleep, and your stress management, either regular physical activity, meditation, yoga, and you should avoid smoking. With the smoking, one good thing, if you are chain smoker of 1 or 2 smoking per day, once you stop smoking, that benefit start immediately after smoking. Your risks start going down with the smoking, and your alcohol should be stopped, or there is a certain limit, documented limit, what amount of alcohol you can take for heart. 60 ml, 1 pack of whiskey, wine, alcohol you can take for the heart, not more than that. That will harm your heart.
And most importantly, just manage your stress, because if you are having a happy life, a happy surrounding around yourself, then it will definitely give a positive aura to you, to your body. So thank you so much, sir, for coming here and giving us the awareness things, the bursting the myths, and telling us how to keep our heart healthy, so that the masses nationally and internationally can listen to you and they can change if something is wrong inside their body, or if they are doing something wrong. So this was it for today, and it was an invaluable insights from him. We hope this conversation has inspired you to take charge of your heart. And remember, one world, one heart, and it's beat stronger when we care for it together. Until next time, stay informed, stay healthy, and keep your heart beating strong. Thank you so much.
Thank you.